Senior Clinical Lecturer at the University of Exeter's Medical School. Doctor, always a pleasure to have your analysis. First of all, your thoughts about the distribution now of this Russian vaccine and civilians being given the shot.
I think caution is required. I understand that at the same time as Russia distributing this vaccine to people, they're also undertaking a phase 3 trial in India. Now, the two are not compatible. Really, with respect to vaccines, we have to go through all precautionary measures possible and therefore undertake the extensive phase 3 trial before giving it out to everyone, because otherwise we're making mistakes and we're being a bit too impatient.
Presumably the Russians must have shared the formula with other countries if the vaccine is going to be manufactured in those territories. Do you know of anyone who understands and has knowledge of its contents?
It's not a big deal, really. With respect to its contents, it will most probably be a candidate protein from the virus, and then that candidate protein induces immunity. So that's not a big deal at all. The big deal is this: does this candidate protein have any side effects? Does it have any long-term side effects? Does it have unknown, unusual side effects? Those are the things that you need to establish first in a phase 3 trial. And that's why we do these phase 3 trials, to make sure there are no significant side effects in all age groups, in all types of people.
Yeah, absolutely. The mind goes back to just a few years ago, around 2015, 2016, and the years after that, when Sanofi, the French pharmaceutical giant, after 20 years, I believe, of research and at least $2 billion, came up with a drug to fight dengue fever, sent it to the Philippines, and now the Filipino government looking into taking out a case against Sanofi because hundreds of children died. The case only involves 10 of those hundreds who died after being given that particular drug. So what's the time frame that we need to be looking here with the Russian Sputnik 5? At what stage would you be happy after it's been given to many, many people that actually at this stage now we could probably say it's safe because we haven't seen the bad side effects you're talking about?
Yeah, the time phase is not long. And the reason why the time phase is not long is because we have the privilege of funding. And we've also got a ready population. So in India, we've got widespread infection. We have a crowded country, and therefore we will be able to do a phase 3 trial very quickly, very efficiently, because it will be properly funded. So I wouldn't be worried about time. What we want is numbers. So once you have gone through a critical mass of numbers, which is, in the thousands, it's not in the millions. So let's pick a number. Say you inoculate 10,000 people, and then you inoculate another 10,000 people with a dummy vaccine, and then you follow them up over a 6-month period, and you observe for any signs and symptoms, and also persistence and consistency of immunity, then you know you've done the due diligence with the right number, the right age group, and then you can be more confident with giving the vaccine out to the general public and population in Russia and elsewhere.
What are your thoughts about the pause here in the AstraZeneca Oxford University vaccine? AstraZeneca said no need to be overly alarmed. This is a normal procedure that we would take this step.
This is a good thing to see. I mean, I'm not pleased. Of course, don't take me wrong. I'm not pleased about it. But what I'm saying, it is a good thing because it shows science in operation. In other words, the precautionary principle is being applied in that it is in a phase 3 trial. Suddenly, one of the volunteers has become ill. Now, what we need to do is, what is the illness? Is it related to the vaccine? Is it completely unrelated? Is it a coincidence? Because when you test a lot of people, you will pick up coincidences. So we need to be careful, cautious, and stopping this is a good sign that this is being done properly. It may just be a coincidence. And if it is just a coincidence, we will be able to move on once we've analyzed cause and effect, if there is any cause and effect.
Dr. Bharat Pankhania, thanks so much for taking time out of your day to talk to us.
Thank you.
Take care.